remarks as well. Let me, if I might, just give an overview of the problems. You've already heard some of the aspects of the problem. The first point that we have got to make is that in this nation, ostensibly the richest nation in the world, we have got to ask ourselves a simple question. How come in every other industrialized nation on earth, with the exception of South Africa, and we should be wondering why we share this commonality with South Africa, every other nation has, in one form or another, a national health care system which guarantees health care for all of its people. Now, it is true that the national health care systems around the world are different. The Swedish system is different than the English system, which is different than the Japanese or the German or the Canadian system. But basically, all of them share the common accomplishment of saying that if you are a citizen of this country, you are going to be guaranteed all of the health care that you need without out-of-pocket expense. Yet we do not do this. In our country, 35 million Americans have no health insurance. 50 million Americans have partial health insurance, which means that if you end up in the hospital or you have an accident, you're going to go bankrupt paying off those bills. In terms of our infant mortality rate, we rank 22nd. I repeat, 22nd in the world. Not a very positive accomplishment for this nation. In terms of life expectancy, how long do we live? We rank 12th in the world. Over 20% of the women in our country receive inadequate prenatal care. 40% of our toddlers are not fully immunized. In other words, my friends, we have a health care system which is disintegrating before our very eyes. Now, some may say, given that record, that dismal record, well, maybe we're being cheap. We're just not putting enough money into health care. Let's just start pouring some more money into the problem. And yet, my friends, of course, that is not the answer. Because on top of the disgrace as to how poorly our system functions, we must make the point that this dismal system is costing us far, far more per capita than any other healthcare system on earth. There's an interesting chart, I don't know if the cameras can pick up on it, but it talks about per capita health spending around the world. The point is that in the United States, we spend close to $2,400 a year per capita. The Canadians, which have the second highest per capita spending, are at $1,683. We spend 40% more than the Canadians, over twice what the English do, and so forth and so on. In terms of our health care spending as a percentage of our gross national product, we are leading the world. As Congressman Torres mentioned a moment ago, the cost of health care is zooming up in my own state of Vermont. Elderly people are looking at 20, 30% increases in their health insurance. Having said all of that, what's the solution? Should we continue to talk about this issue for another 50 years? Because we should remember that in 1948, when Harry Truman ran for president and won, you know what he talked about? He talked about the need for a national health care system. Now, some people say that Congress moves slowly. I agree. But, my friends, 43 years is even very slow for this institution. What's the solution? What do we do? Well, I think, really, we know the information. We know what we need. We know the direction that we've got to go in. And we know why, for 45 or 50 years, we have not yet got there. The most important fact to understand is that if, in terms of movement in health care, if we move toward a national health care system which guarantees health care for all people, which is comprehensive, and which is single payer, which finally says that this nation can no longer afford the 1,500 separate private health insurance with their myriad of different policies, with doctors going crazy trying to fill out the bills, with hospitals asking, gee, do we cover you in Connecticut General for aspirin, you for Blue Cross and Blue Shield for this and that? If we finally say that we can no longer afford to accept the 1,500 separate health insurance companies and move toward a single-payer system, The General Accounting Office of the United States Congress recently estimated that we could save $67 billion. Using more recent figures, a study in the New England Journal of Medicine indicated that the savings could be $100 billion moving towards single payer. One system, one insurance company for rich and poor, young or old, saving $100 billion, which we then take out of the bureaucracy, take out of the billing, take out of paper pushing, use that for health care. And you know what? Without money, we can guarantee health care to all of the uninsured, all of the partially insured. We can, in fact, have a national health insurance system without spending one penny more than we're presently spending, an estimated $700 billion. We can guarantee health care for all of our people. So I think, my friends, the answer is that this Congress has got to do something which, in fact, is very hard for this Congress. And that is we have got to summon up the courage to stand up to the private insurance companies, to the AMA, to the pharmaceutical companies, to the medical equipment suppliers, to the people who are making billions and billions of dollars out of this disintegrating system, and saying, sorry, our priority is not profits for you, but health care for all the people. I would ask my colleagues to join me in moving forward toward a single-payer national health care system for all of our people. We can have that without spending a penny more than we are right now, and I thank the gentlelady from Ohio.